Good morning, and welcome to everyone in the viewing audience to our webcast focusing on the 25th anniversary of the Ryan White Care Act, a conversation with Congressman Henry Waxman. It's really a great pleasure to welcome you today to this discussion about the history of the Ryan White Care Act and how it's unfolded over time. I'd like to welcome Congressman Waxman, Professor Westmoreland. We're so glad that you're here at the School of Public Health this morning to share in this discussion. And for our viewing audience who can see the bios for our speakers already on the website, I just wanted to give a very brief introduction because both of these men need no introduction. When Representative Waxman decided not to seek re-election in January of 2014, President Obama issued a statement, and I'd like to just read 3 or 4 sentences from that. President Obama said, "Early in the 20th century, Henry Waxman's parents came to America, the land of opportunity, and found a place where they could build a better life for themselves and their families. Over the course of 40 years in Congress, their grandson has fought to give every American that same chance. Thanks to Representative Waxman's leadership, Americans breathe cleaner air, drink cleaner water, eat safer food, purchase safer products, and finally have access to quality, affordable health care." And today he continues to advocate tirelessly on behalf of Los Angeles and California as he leads effort to address a changing climate and make sure every American has the economic security that comes with health insurance. He will leave behind a legacy as an extraordinary public servant and one of the most accomplished legislatures of this or any era. And the president said it so well. It's terrific, and we owe you such a debt of gratitude, Representative. It's been terrific, many accomplishments. And Professor Westmoreland, a great colleague and an old friend. And Professor Westmoreland is now a professor of law and public policy at Georgetown University. And among his previous roles, he was director of Medicaid at the Department of Health and Human Services. He was counsel to the Kessler Advisory Committee on Tobacco Policy and Public Health, and has been a senior advisor in the Kaiser Family Foundation and an advisor to the Elizabeth Glaser Pediatric AIDS Foundation. And from 1979 through 1995, Professor Westmoreland served as counsel to the Subcommittee on Health and Environment in the U.S. House of Representatives under the chairmanship of Congressman Waxman. And again, I want to thank both of you for all you've done in the era of HIV and AIDS, people living with HIV, communities disproportionately impacted, and all of us who've worked in this era for so long owe you a tremendous debt of gratitude. So thank you, and again, welcome. Well, I thought maybe we could use our time this morning to reflect on 4 or 5 questions, and we can see how the conversation flows. I wanted to start by reflecting on the history. Since it's the 25th anniversary, it's hard to believe it's a quarter century since the beginning of the Ryan White Care Act. And it's now become a $2.3 billion a year program serving 530,000 or more people per year. And I just wondered if you could reflect back on the history of helping to craft and be key architects of the Ryan White Care Act. At the beginning, what did you envision for the CARE Act? What were you hoping to achieve? And can you take us back into that history a little bit, if you don't mind?
Well, Tim Westmoreland and I worked very closely together. Tim was a staff on the Energy and Commerce Subcommittee on Health and the Environment. And in the beginning of the 1980s, when President Reagan took office, he proposed a budget to cut the public health programs. He wanted to cut taxes for the upper income, less revenue would come in, and therefore he wanted to make cuts on the safety net and the public health programs. And he proposed to cut the vaccine program and other public health programs as well. We were concerned about it, and Tim Westmoreland went down to the Centers for Disease Control and talked to, was it Dr. Curran?
Jim Curran.
Jim Curran.
Who's now the dean at Emory.
Yeah.
And came back and told me that Dr. Curran was talking about a rare form of cancer called Kaposi sarcoma affecting gay men in New York, Los Angeles, and San Francisco. And it was multiplying geometrically. We didn't even know this was called AIDS until a while later. In 1982, we held our first hearings on the subject at the Gay and Lesbian Service Center in Los Angeles. And we brought in people from CDC, from UCLA who were involved in treatment to try to find out what was going on. That was the first hearing on the subject, and we held 30 or 40 hearings after that to find out the status of the research, to understand where this disease was going, and what measures would make sense to stop it. After these hearings, we proposed legislation that recognized that the first victims were gay men. They had no protections at all from discrimination, from a violation of their privacy, and if they came forward and talked about how they had this disease, they would lose their jobs, they would lose their health insurance, they would be out in the community, and in many states in the United States, it was a criminal offense to be a gay man and to engage in gay sex. So we were dealing with a vulnerable population, not just to the disease, but in other ways as well. And we wanted the legislation to protect these people, their confidentiality, their privacy, and to put some money into research, and as well to be of assistance to these sufferers, people with AIDS, to get the pharmaceuticals that they needed, especially within a couple of years when new pharmaceuticals were coming available that would stop the transmission from HIV to AIDS. We didn't know AIDS at first. We didn't know certainly HIV. We didn't even know there was any cure, but we wanted to move forward. That was in 1982. We didn't pass the legislation until 1990. Now we're celebrating the 25th anniversary of it. But it was a long process of holding hearings, getting the best guidance from experts as to what ought to be in that legislation, and dealing with a very difficult political situation. This should not, and ultimately was not, a partisan fight, but it was very difficult for a lot of members of Congress to deal with it because it was a gay disease, and President Reagan wouldn't even mention the word AIDS until 1986. The epidemic had been going on for 5 years. He kept on insisting that enough money was going into combating the disease when that wasn't accurate. And we had a bill that at one time gotten all the way through House, Senate, Conference Committee, and then was stopped by Senator Jesse Helms, who said if you talk about gay sex and IV drug use, that will only encourage people to engage in these activities. And of course that was ridiculous. But he stopped the legislation, and every 2 years we had to come back until 1990 when the law was finally passed. Tim can tell you more about the details of those early days and what we expected from the legislation and how the legislation changed over the years between 82 and 90.
Well, as Henry is saying, in the very early days of the epidemic, the focus was very much on biomedical research and public health, trying to understand what the disease and the epidemic were. And those were the early hearings that we did. As far as taking care of people, as helping people, there wasn't much that medical science could do except sort of watch people slowly fade away. But come the mid to late 80s, there started to be drugs developed, especially early on, the drugs to prevent the pneumonia and the tuberculosis, the infections that came with AIDS. The drugs were developed that were shown that there was something that could be done by medicine to help people while they were sick. And then not that long thereafter, our first antiviral, AZT, came along. And so it became clear that the agenda needed to expand beyond just the biomedical research and public health activities, but the agenda needed to expand, the health agenda, to include how to help provide services to people who were sick. And that really was a sort of watershed time of when we went from the time of what is it to how can we get what we know to people who really need it. And that's when I think would probably be the prototype of the Ryan White Act started in, because the public health view, and Henry's view and my view certainly at the time was, we've gone to a time where counseling and testing is the first step into getting into care. And yet, as Henry very much emphasized here, gay men and drug users were very afraid of testing. It was being used against them, not for them. And it was at a time when people were proposing things like tattoos and quarantines and roundups and criminalization. And so we needed an effort to try to expand counseling and testing to get people into treatment, to get them to get these early drugs. And at the same time, we needed to remove the roadblocks of confidentiality problems and discrimination. And that was sort of the very first spark of the Ryan White Act, was to start into, we need to expand counseling and testing because now there's something that can be done. And then we need to help poor people, low-income people, pay for getting those services once they know that they need them. From then it expanded into a more comprehensive services package. I think some people will remember that there was a time when emergency rooms around the country were just overwhelmed with the number of people with AIDS in the emergency rooms, which is a problem for the people with AIDS. They weren't getting services, and it was a problem for everybody else because the car crash victims and the trauma victims couldn't get into the emergency rooms either. So the next step was to expand, in the Ryan White proposals, was to expand healthcare services so that in many ways we could move to a more appropriate model of providing healthcare services outside of major medical emergency room. And that got combined with the Ryan White Act too. And that, as Henry was alluding to, had wide-ranging bipartisan support.
Well, and it's such a great segue because I'd love to ask you about this issue of bipartisanship. And I was struck, Representative Waxman, in your book about some of the stories of where partisanship could be roadblocks, but also struck by recently at the 25th anniversary event at the White House where you and Senator Hatch both spoke so eloquently about how bipartisanship was more alive and well in a certain era and enabled things to happen. I wonder if you both could reflect a little bit on this issue of partisanship, bipartisanship, and how that helped or hindered the early passage of the Ryan White Care Act.
Clearly, this was not a partisan issue. Health and this disease were not affecting Democrats and not Republicans or the other way around. And so at the beginning, we got a great deal of receptivity by Congressman Madigan, who was the ranking Republican on the subcommittee. He said, this is an issue we could work out. We can get bipartisan support. He was going to talk to the Republican leadership to be cooperative with us. But then he moved on to become Secretary of Agriculture, and the man who took over his spot was a fellow named Bill Dannemeyer, also from California. And Bill Dannemeyer, it was the worst time for someone like that to be the top Republican dealing with this issue, because he was so filled with hate for gay people. He was obsessed by it. He would often go to the House floor and read long statements after the session had closed about details of gay sexual activities. When we had a hearing on this subject, or almost any subject, he kept on saying, well, we've got to get the names of all these people. We've got to get the names and keep a list so we can round them up and take them to an island someplace to quarantine them. Well, you can imagine the impact of statements like that throughout the gay community and the IV drug using community. They were fearful enough, and this drove them away from the public health rather than bring them into getting health care services. So that was a very difficult situation because a lot of Republicans didn't want to take him on, even though they certainly disagreed with him. When we finally passed the legislation, it was strongly bipartisan. In the Senate, Senator Kennedy was our counterpart, and he had Senator Hatch with him. And they did a bill increasing money for research. They didn't have all the other parts in it because they couldn't get it through. And then when we went to conference, we had a more expansive act. It was even named after Ryan White, a young boy who had AIDS through a blood transfusion. It became somewhat of a hero in Indiana because they kept him out of school. There was such fear that this could be a disease transmitted in a casual way. And he passed away. So the idea came from the Senate. I don't know if it was Senator Kennedy or
I don't
Senator
know
Hatch.
whose idea it was. It was an idea that was definitely one that was proposed to Senator Dan Coates, who was a linchpin in bringing Republican support for the bill.
Yeah, and he came from the state of Indiana, and the idea that this bill was named after Ryan White meant a lot to him, and to the community that had been suffering from AIDS. Ryan White was a hero. He and his mother played such an important role in educating people. Another person who played, talking about partisanship, an excellent and important essential role was the Surgeon General at the time, C. Everett Koop.
Yeah.
Dr. Koop came in to that position when President Reagan appointed him, and apparently because he was an anti-abortion crusader. But when he was in that position, he did a marvelous job. He was the exemplar of what a Surgeon General ought to be. And he said this is a disease that can be transmitted through sex, whether it's homosexual acts or heterosexual acts. It's not casual, so people ought not to be fearful of it, but it is one that can be transmitted and can get out of control. So he even sent a piece of mail to everybody in the country to educate them about it. He was an eloquent spokesperson for taking a medical approach. He said, I'm the Surgeon General. That means I'm here for public health. I am not the nation's preacher, and I'm not going to preach morality. I'm going to talk about what's important for health. And he, of course, was a Republican. A lot of the Republicans turned against him after he spoke out to deal with the AIDS problem, and then spoke out against tobacco. But he was a great hero, as many people were, Dr. Fauci and others, throughout this time.
Going back to your original question, I'd say that for me, there's a difference between partisanship and irrational response. There was, as Henry says, there was a lot of bipartisan Republican and Democratic support for doing something to respond to the epidemic. In the face of that, there was also, principally, I have to say, on the Republican side of the aisle, but not completely on the Republican side of the aisle, people who were really so motivated by how much they hated gay people, or what I used to say was how much they hated who was getting sick, and that they let that hatred and homophobia get in the way of what everyone in the public health and medical community was advising that we do, of trying to bring more people into counseling and testing and more people into treatment. And so in answer to your question, I think it's not so much partisanship. I mean, as you say, Mr. Hatch and Mr. Waxman actually have had a very good political relationship over the years. Mr. Hatch, Mr. Kennedy, Mr. Madigan, and Mr. Waxman also. But there were some people who let their dislike of who was getting sick get in their way. It's kind of hard to remember post all these Supreme Court decisions expanding gay civil rights and things like that, but it was not just acceptable, it was routine for politicians to speak out against gay people per se. And so that really complicated the Congress's reaction. But I don't want to say that it was just partisanship. It was irrationality in some quarters.
But it was interesting that the gay community was the first victim group, because we were talking about a lot of well-educated people who were determined to do something about it, and they did something that was so impressive to me. They learned the law about the Food and Drug Administration and went to the FDA and argued, you don't have to wait till all the evidence is in to show that a drug is safe and effective. If we wait that long, too many people will die. There can be a compassionate use under the existing law to allow drugs to be made available. And that changed the way FDA operated. But you asked where we are now with the Affordable Care Act, because Ryan White became the way that people who had HIV and AIDS got care everywhere in this country. Because so many of those people didn't have insurance, and this program was specialized for this particular disease. Now we have the Affordable Care Act, which has meant that people could get insurance where they couldn't in the past. People could get Medicaid if they were low income. But when they go into an insurance plan, whether it's Medicaid or private insurance, they're really not as equipped as the people working in the Ryan White programs to deal with the specifics and many needs of people with this disease. And so it's been an interesting process to see how the two have been working together. I'm going to defer to Tim on this question because I know he's much more involved in how. I don't think Ryan White ought to be eliminated,
No.
but how should they be put together so that we get the care for people who need it?
These days, without revisiting the history of how we got to the complicated health insurance system that we have, I've described the Ryan White Care Act in the era of the ACA as the safety net under the safety net. That first, they're going to be, because of the Supreme Court opinion, there are going to be a lot of people in Medicaid non-expansion states who still don't have health insurance. And in those states, people are going to...
Excuse me, just a clarification. The Supreme Court opinion that said the
I beg your
Medicaid
pardon.
expansion was left up to the states,
Right.
even though that was never what Congress
That
intended,
was-
but the Supreme Court rewrote the law.
Yep. So in those states in which the governors are choosing, because of the Supreme Court opinion, they have the choice. I am a law professor. I have to bring that up every now and then. Those states, a lot of people are left in what has been called the coverage gap, and they don't have health insurance one way or another. So that's the same as it was before the enactment of the ACA for many people. In addition to that, some of the Medicaid programs are quite strict in what they'll pay for and what they won't pay for, and many of the services that people with AIDS definitely need may fall outside of what some of those very tightly limited Medicaid programs will pay for. For instance, I think the concrete example is a number of Medicaid programs have a strict limit on how many prescription drugs per month you can get, no matter what your diagnosis is. I also don't think that's the spirit of the Medicaid statute, but we can revisit that another time. But for people with AIDS especially, they may need more than this number of scripts that are allowed under the Medicaid program. And in those situations, they can turn to the Ryan White Act to get the rest of what they need. So the safety net under the safety net for Medicaid. And then in addition to that, a lot of private health insurance is not focused on the needs of chronically ill and disabled people in general, and of people with AIDS in particular. And for those people, they can turn to the Ryan White Care Act to get some of the services that private health insurance may not cover. So that's what I'd say: the safety net under the safety net. It will continue to be needed, especially until we get all 50 states expanded to Medicaid, and until health insurance starts responding better to chronically ill and disabled people.
So the program's clearly evolved. That wasn't what we thought when we were starting the Ryan White Act, but it evolved to be the safety net under the safety net.
But I want to emphasize, one of the sparks for the Ryan White Care Act was trying to get more people into counseling and testing. By now, we have the Americans with Disabilities Act, we have a series of medical confidentiality and privacy protections, and now it's routinely recommended for so many different populations to get routinely counseled and tested about their HIV risks and whether they've got it, so that people can get into healthcare. And to that extent, I think the Ryan White Act has actually pioneered what the rest of American medicine has followed to do. The Ryan White Act succeeded in getting more people into testing and therefore into treatment.
That's great. And I knew that when we began our session that time would fly quickly, so we only actually have 4 minutes left. I can't believe it that we've only have time for one more question. But I just wanted to take our last couple of minutes and ask you both, given the people who are working on HIV now, are there lessons either from the recent past or the past of putting together the Ryan White Care Act in the earlier days of the epidemic that you would really like people working on HIV or living with HIV to hear about and know? And are there things that we should avoid repeating mistakes? For instance, when I think of the era of TB control in the U.S., we tend to have a history of we do pretty well, we let our foot off the throttle a little bit, TB comes back because we cut funding, then we put more funding into TB and things look a little better, and there's kind of this history that we seem to repeat over and over during the years. And just wanted to, if there's any sort of cautionary tales that you'd like to leave us with, or words of encouragement.
I think the first 25 years of the epidemic has been at least from policymaking perspective, has been a time of going from complacency to hysteria and then back to complacency again, what you describe of tuberculosis. And I think we're in a period of complacency right now, but the epidemic is still very much with us in the U.S. and worldwide. And so I guess, what Henry and I have always used as the word along the way is trying to keep urgency without complacency, without hysteria, but without tipping over into that fear-mongering or scary stuff to tell people that the world is coming to an end because of an epidemic. So continued attention and urgency is what I would say.
I think that's right. We've got to be mindful of a disease that is so serious and, of course, around the world, a major problem. And one of the good things I want to say on a bipartisan basis about President George W. Bush is that he pushed for PEPFAR, which has been a godsend all over the world in dealing with the HIV/AIDS epidemic elsewhere. But we're getting more pharmaceuticals. That's important. People have to keep using them, and we have a better chance to intervene and prevent HIV to AIDS, but even HIV itself. And we hope someday, as President Obama said, that we can have an AIDS-free world, whether through a vaccine or something that acts as a vaccine to prevent people from getting the disease in the first place. That's our goal, that's our hope. But in the meantime, we've got to attend to those who have it, prevent transmission from HIV to AIDS, and be mindful that these are people who are suffering, and we've got to treat them from a medical perspective, and not even think about all the other baggage that we had to deal with in the beginning of the epidemic, the discrimination and the prejudice.
I want to thank you again both so much. As you know, the motto of the School of Public Health here is saving lives millions at a time, and for the School of Medicine, it's saving millions of lives one at a time. And I think both of your careers have exemplified both of those things so very well. That there's so many people living with HIV and so many communities so impacted by the work you've done. So thank you both again. And I just wanted to say to the audience viewing in, if you happen to be viewing here at the school or on campus, from 11 to 1 today in Sheldon Hall, we're privileged to have a panel to talk about how these lessons relate to the National HIV and AIDS Strategy recently updated by President Obama. And then from 1:30 to 3 today, we'll have another panel on how these lessons, the National AIDS Strategy, all plays out here in the city of Baltimore. And that will also be at Sheldon Hall at 1:30. So I think we'll bring our webcast to a close, and thank you all for listening.
Thanks very much.
Thank you very much.
Good.